This, I think, we will hand it over the podium to Honorable Minister to take us through the press release.
Okay, thank you, and I welcome everyone and the Secretary, my acting and the Secretary, all present in the room, professionals, the directors, Director Generals, and academicians, researchers, and of course all the media houses. Assalamu alaikum. Today we are making a press release on the 10th East African Scientific Conference that will be held from June 25th to 27th in Juba, the Republic of South Sudan. The Republic of South Sudan is hosting the 10th East African Health Scientific Conference, which will take place in Juba at the Pyramid Continental Hotel from the date 25 to 27 of June 2025, under the theme Addressing Health Priorities and Advancing the East African Region Health Agenda to Meet Global Health Targets. This conference will bring together important delegates, keynote speakers, researchers, and participants to share regional scientific health research, concerns, and interests. Invited guests and participants will come from all the 8 partner states of the East African Community, abbreviated as EAC, including the respective ministers of health, ministers of the EAC affairs, senior dignitaries from the EAC organs, other relevant dignitaries, academicians, health professionals, students, and invited international experts and friends of the EAC under the auspices of our guest of honor, His Excellency General Salva Kiir Mayardit, the President of the Republic of South Sudan. The East Africa Health Scientific Conference is an event that was approved in 2006 by the 12th Ordinary Session of the EAC Council of Ministers to be convened in East Africa. This conference takes place every 2 years and is hosted on rotational basis in all the partner states of the EAC, led by the Ministry of Health and the Ministry of the East Africa Community Affairs, working closely with the academia, health professionals, and other interested health partners and institutions. The conference is also organized jointly with other sectors that contribute to health scientific research to fight disease and achieve health. We have to tackle other fronts in food security, safe water, airborne and zoonotic diseases, environmental hazards, cross-border transmissions, traffic accidents, regulation of food and drugs entering the country, and the list is long. The education sector plays a fundamental role to all the knowledge base and is key to the future of health. Therefore, this conference brings together the best researchers in health and all health-related sciences from all the EAC member states to present and discuss their health research work and any new research ideas under one roof. This is a platform of knowledge exchange and sharing between countries. The purpose of the conference is to strengthen regional cooperation in health in accordance with Article 118 of the treaty that established the EAC and is in line with other relevant provisions of the EAC Common Market Protocol. From the time of its approval in 2006, 9 conferences have been conducted in the different East African countries. It was during the closing of the ceremony of the 9th conference in Rwanda that the Republic of South Sudan took the torch and committed to host this 10th conference, which will now take place in Juba next week on June 25 to 27. So it took too long processes of preparations over the last several months to convene this conference. The National Steering Committee of the Republic of South Sudan worked with other counterparts in the Secretariat of the East Africa Research Commission to call for abstracts from the region based on the theme and sub-themes of the conference. These abstracts have been reviewed by a group of experts, and the best abstracts are the ones selected. This year, 218 abstracts have been accepted. They will be compiled into a book of abstracts, which will become a useful reference for the EAC. I am pleased to announce that 78 of these accepted abstracts for the 10th conference were submitted from South Sudan. This encourages us to do more and opens a great window for South Sudan to share its scientific health concerns and findings with other experts from the region. During the conference, the best abstracts will be presented, and participants can ask questions and discuss research findings on various research topics under various thematic areas and sub-themes. There will also be important symposia where panelists will discuss some important health concerns in the region. We encourage all our invitees to come and participate, to ask those questions they have longed to ask, to contribute their viewpoints on the various findings in the areas of health that interest them, and to be inspired by the wealth of health scientific research that will be presented. This is an opportunity to interact with our health experts from the region, learn from them, and share our knowledge and experiences with them. Our young students from the universities who aspire to be the future health professionals in the region are especially welcome to meet their role models and career inspiration. Thank you, and I am Cleto Rial, the Minister of Health, Republic of South Sudan.